We are so delighted to welcome Dr. Nao Haba.
Hi everyone, my name is Dr. Haba.
Thank you, Dr. Haba. Then could you introduce yourself?
Sure. I worked as a physician in Japan and the United States Air Force Base Hospital located in Japan. After working as a physician or volunteer worker in Japan, the United States, Thailand, and Myanmar, I noticed that there are so many impacts on the patient's health from outside of the hospital and the importance of using available material in each environment. So I'm learning a master degree of public health now to learn social and environmental determinants of health and how to strengthen a health system.
Thank you so much for your introduction. Then I would like to know, what should we learn from the COVID-19 pandemic and how can nurses respond to it?
Sure. I think there are so many impacts from COVID-19 pandemic, as you know, but one of the learnings in public health is that racial disparities had a large negative impact on health, such as mortality rate and positive rate. There are so many reasons for that, but I'd like to mention two things today. First, most of them are in low socioeconomic status, and this makes it difficult for them to get appropriate medical access. And second, from the history or their own negative experiences in medical facilities, sometimes they have mistrust in science or medicine, which makes them be reluctant to get medical care. To respond to these problems, I'd like to suggest two things for you. So first, please understand your community well. It is very easy to mention history or disparities, but in reality, the details of disparities are so much different in each area. Even in the same country, the proportion of race or culture can be different from place to place. That is why it is really difficult to react to those local problems by a single policy. So I hope you consider what kind of problem of health there is in your community. Nurses are in a great position to notice many problems by taking care of patients and by collaborating with many kinds of medical professions. That is your strength. And please raise your voices to the others, such as your colleagues, boss, or local authorities. Now you may not know whom to talk about your worry or whom to ask your questions, but at first, please raise your voice to talk about it to someone you can reach. Then the person may know what to do next. The chain of reaction will improve the medical experience of people who are of low socioeconomic status, who are suffering from the specific problems in your community. And second, please try not to have implicit bias to any patient. By working in a hospital for a long time, you may gradually lose connection with people who have no non-medical backgrounds. To be honest, this reflects my own experience while I was working in a hospital. The more I get the medical knowledge and skills and common sense in a hospital, the more you may forget how you have been feeling as one general patient. This leads to less understanding of how patients think or feel. It may become difficult for you to understand the patient's irrational behaviors or thinking, which have negative impacts on their health. And sadly, there are several reports that some people in color or gender minority group have experienced discrimination in medical facilities. That connects to their mistrust in medicine or science. However, most of the time, these patients' irrational behaviors come from the environment or systemic problems of society. After beginning to learn public health for the first time, I came to understand that fact that some people are targets of a company which sells unhealthy foods, or some people are in the district in which they face difficulties to get fresh vegetables. As a nurse who works beside patients, I hope you make an effort to understand or imagine how they got difficulties. You can do this, for example, by organizing informal conversations with the local community outside the hospital, or just by talking with your friends who do not have medical backgrounds, and please ask them how they think about their lifestyle and health. These efforts will improve your empathy to the patients, and the result, their experiences in a medical facility will be much better. And the important thing is that their mistrust will be decreased and that they are encouraged to visit a hospital to get enough care.
Thank you so much for your amazing talk. Finally, could you give us a message to nursing students and nurses who will become the future leaders in the society?
Yeah, of course. So I'd like to tell you, please be proud of your knowledge and skills as a medical professional. At the same time, please be modest to listen to others, especially for people who have no medical backgrounds. It can be your family, friends, neighbors. And please raise your voices with your love for the community to which you belong.
Thank you so much, Dr. Haba.